Okay, so hello everyone. Before we start today, I want to acknowledge with respect the Indigenous peoples and communities whose historical relationships with the land continue to this day and on whose traditional territories our work takes place. While we meet today on a virtual platform, we can take a moment to acknowledge the importance of these lands, which we each call home. We do this to reaffirm our commitment and responsibility in improving relationships between nations and to improving our own understanding of local Indigenous peoples and their cultures. So my name is Autumn Sipis. I am a project manager with the Canadian Coalition for Green Healthcare. And on behalf of the coalition, I would like to welcome you to today's webinar, How Green is Green, Differentiating Within the Bioplastics Palette. Throughout the event, please use the chat function for any technical issues you may be experiencing. We also encourage you to introduce yourself if you'd like in the chat. Love to see who's joining us today. And please use the Q&A function if you can for any questions you have regarding the presentation. Our speakers will be answering questions at the end of the event today. We are also recording this presentation, and the recording will be sent to all registrants and be available on our website and YouTube channel at a later time. I'm now going to hand things off to our facilitator, Sandra Zander. Sandra graduated from McMaster University with a Master's of Science in Global Health, combining her passion for promoting human health and years of experience leading interdisciplinary teams to implement sustainable changes. She joins the coalition as a manager for the Single-Use Plastics Reduction Project. Led by her enthusiasm for innovation, Sandra is eager to collaborate with healthcare and environmental leaders to build a healthier future for people and the environment. Take things away, Sandra.
Thank you, Autumn. Hello, everyone. As Autumn mentioned, my name is Sandra, and I'm the project manager at the Canadian Coalition for Green Healthcare. And I'm also happy to welcome you to this webinar in partnership with CASCADES to critically explore how green is green when we are deciphering between the materials that we use when providing care within a clinical setting. Plastic has been the default for years, and there is global recognition that the plastic waste is not sustainable. And so the topic of bioplastics has started to gain popularity, with the question being, is bioplastic a solution to reducing the environmental burden of plastic waste? Before being able to have these conversations, though, it's important to understand what plastic actually is. By definition, it refers to synthetic materials made of polymers that could be molded and set into a solid shape. And so, really, plastic is an umbrella term that the diversity of what their polymer composition is allows them to be malleable and versatile. So, plastic tools can be shaped, sterilized, and used safely across a vast range of clinical tasks. Plus, plastic itself is a low-cost material, and the effect of all of this is compounded when we actually look at the history of clinical practice, where one-time plastic use is embedded into behavior because it's often associated with sterility. And that association itself can be accredited, at least to some degree, as to why the healthcare sector uses more virgin plastics than any other sector. And so when we look at where plastic exists in healthcare, they're virtually everywhere. So the waste just keeps piling and piling. And it has piled up to the point where in 2023, across Europe and North America, there was a total system emission of 9.3 million tons of carbon dioxide equivalent just from single-use healthcare plastic. And Eunomia and System IQ released a report this year titled Prescription for Change. And this report has become a prominent part of the conversation so quickly because they project that without urgent action, hospitals across the US and Canada could reach 3.6 million tons of carbon dioxide equivalent per year in 2040. And in 2040, they could be facing up to $37 billion each year in plastic waste management costs, which is a 28% increase over today's expenses. So not only is it costing the environment, but it's also costing a significant amount of money that could be diverted to providing direct patient care or infrastructure support. And so one strategy to manage plastic waste is to just reduce it in the first place. And that is what the Circular Clinical Care Single-Use Plastics Reduction Project aims to do. Being undertaken by the financial support of Environment and Climate Change Canada, the Canadian Coalition for Green Healthcare has launched a 3-year project that aims to reduce waste in perioperative care, textiles, pharmaceutical packaging, and food-related services. We have partnered with Hamilton Health Sciences, McMaster University's Postgraduate Medical Education, and Peach Health Ontario to explore opportunities for single-use plastic reduction in hospitals. And we are currently taking everything that we learned from our pilot year and starting to transition to a national campaign. And these are 6 of the 9 case studies and business cases that we are creating for the project, where adopting these strategies means that there is less waste to manage. But sometimes plastic is necessary for clinical practice. And so at that point, is bioplastic a viable, environmentally sustainable alternative to that traditional plastic? And so to answer that, it is a pleasure to introduce the 2 speakers for today's session, Dr. Fiona A. Miller and Mike Apostle. Dr. Miller is a professor of health policy in the Institute of Health Policy Management and Evaluation at the University of Toronto, and she holds the chair in health management strategies and recently co-authored a paper on bioplastics. And Mike Apostle is a dedicated champion for sustainability in Canada's healthcare sector with expertise in healthcare supply chains and sustainable procurement practices. So to start answering that question, I'd like to welcome Dr. Miller.
Great. Thank you so much for that introduction. I'll share my slides and get us started. That's a really helpful get started. So yes, I'm a professor at U of T, where I direct a multi-faculty academic unit called the Collaborative Centre for Climate, Health and Sustainable Care. And with colleagues across the country, including the Coalition, lead CASCADES, which is a pan-Canadian initiative for climate action and awareness in healthcare that's funded by Environment and Climate Change Canada. So yes, I'm speaking to this topic. I'm really the preliminary dish before we get to the deep expert, Mike Apostle, reflecting on work that I've done with colleagues Jasmine Yu, Miriam Diamond, and Brittany McGuire. I think a good place to start on the question of bioplastics is what's new here. And there's a way in which bioplastics in healthcare are not new. We've had more than 50 years of experience with various types of biodegradable polymers, and I'll get to what that means in a moment, that have been introduced and used because they serve clinical functions. They help us to deliver controlled drug release, drugs in a controlled manner. They're suture materials. They're part of device implants such as stents. That's not what's new. What's new then is the growth of claims that bioplastics can address the sustainability challenges that we have in healthcare, principally environmental, that they could help us to reduce the pollution and resource dependency of the healthcare enterprise, while I think it's important to note either improving or at least not worsening the social sustainability issues that we're also necessarily concerned about. So those are the questions we need to answer. And in answering those questions, we really do get a bit perplexed by just what it is that we are talking about when we're talking about bioplastics. This is a bit of a portmanteau word, putting together the biological, and the plastics. And it has a couple of different meanings. There's 2 core parts of this. The first part on the left-hand side of this diagram is pointing to the feedstock for the polymers of plastics. So obviously the typical feedstock for polymers are fossil fuels. So it's possible to use renewable resources instead, biologically sourced feedstock for the creation of the polymers in plastics. We could look to biological waste products. We could look to growing things like corn and using that as the feedstock. So here, the question that we need to ask from a sustainability perspective is that bio-based polymer or biopolymer, in fact, environmentally preferable across the life cycle to the fossil fuel-based polymer? So is it in terms of the energy demands, in terms of the other resources used, in terms of the water, including water, including the pollution that comes from the enterprise in the production process or growth process, in the processing, in the transportation and end of life across the bio-based versus fossil fuel-based polymer? Is it preferable environmentally? And it's not always going to be the case. We're going to find cases where that bio-based polymer is creating enormous water dependencies or other chemical dependencies or pollution impacts that might actually be worse than the fossil fuel-based polymer. And sometimes we're going to have a bio-based polymer that in fact competes with other uses for that biological feedstock. So corn, it's actually competing with food production in some contexts, and that's a social sustainability concern. But those are the questions we need to ask on that side of the bioplastic. On the other side, we have this question of degradation. So here, what we're talking about is whether these polymers are biodegradable. So do they degrade in the presence of microorganisms? So when we talk about something as biodegradable, it's a big category. And all it's saying is at the end of life, the polymer or polymers are degradable in the presence of microorganisms, but it's not telling us, it's not being specific about how long. So we would need to ask, how long does that degradation process last? The other thing it's not being specific about is how complete is that degradation process? Are we left with toxic residues? Are we left with microplastics or nanoplastics? Because biodegradation can result in that. Typically, what we have in our mind's eye when we're thinking about biodegradation is a subset of things that are actually compostable. So when something is actually compostable, we are talking about complete degradation. We're talking about mineralization. So what is left at the end of the biodegradation process is carbon dioxide, is water, is minerals, and is biomass. And there is no visible or toxic residue left behind. So that's what we're looking for. Now, of course, the twist with composting is we also tend to think that we're talking about like backyard composting, but a lot of composting is actually done at industrial scale in industrial facilities that use heat and pressure to accelerate and intensify the composting process. So we have to ask the question, are these compostable polymers actually compostable in the existing industrial scale composting settings? What we will discover is that the answer is sometimes no. So the bio-based source is not necessarily environmentally preferable. The biodegradation process does not meet the standards of compostability, i.e. complete degradation, and/or we don't actually have the facilities to ensure that complete composting. So these are the questions we must ask, and these are the challenges for just making sense of bioplastics. The next challenge is just the challenge of plastics more generally, including bioplastics. So even if we have polymers that are biologically sourced from renewable materials or are unto themselves completely compostable in settings and contexts that we have, we still have the question about what else is in the plastic product, because plastics that we use are never just the polymers, or virtually rarely just the polymers. They are the polymers plus the chemicals that have been intentionally added to produce the functions that we want, that they are soft, malleable, pliable, or that they are rigid, that they are fire retardant, or that they allow slip. All of these features that we require in our plastic products are produced through chemical additives, as well as there being other intentionally added chemicals, such as starting materials, and surprisingly, perhaps, non-intentionally added substances that during the process, solvents get in, or manufacturing impurities are present, or there are impurities from a recycled feedstock. So all of these chemicals are of concern. So this is from a UNEP report, United Nations Environment Program, because chemicals and plastics are a real environmental concern for human health and the health of all our relations of the ecosystems of our world. So there are at least 13,000 various chemicals in these products. We don't have good data on all of them. About half of them have been analyzed for their hazardous properties, and of those, almost a half are of potential concern. And one of the challenges for us as consumers of products is companies are not fully transparent about what chemicals are in that product. So we are facing this twin challenge of trying to understand the bio part of our plastics as well as the additional challenge of the chemicals in those plastics. So what do we do with this? Well, my answer is twofold. First, let's demand real innovation. I'm not suggesting that there can never be sustainability opportunities from healthcare bioplastics. I have hope that innovators are going to deliver higher value at the same or lower cost. And that truly is the definition of innovation. But for that to be the case, those of us on the demand side, the users, have to be clear and consistent in our demands. We can't settle for greenwashing. If we settle for greenwashing, if we settle for lower value at same or higher cost, or uncertain value, then how are we going to shape the market to deliver the innovations that we actually want? And this is why procurement is such a powerful instrument and why it's such a challenging instrument that we have to use extremely effectively. The other thing to say is to sort of echo what Sandra was saying, that even with the best healthcare bioplastics that are solving some of our sustainability issues, we will need to retain the goal of reduced use. That is reducing unnecessary use. The good example of that is non-sterile gloves. That is improving the stewardship of the products that we have, and that is increasing reusables. So this is a nice playbook from Cascades detailing that. And with that, I'm going to pass it over to Mike to carry us for the rest of this presentation.
All right. Thank you, Fiona. Let me just get my presentation up. Okay. So I'm here to kind of talk about biodegradable PPE and why greener isn't always better. So Mike Apostle, I'm the energy management specialist at London Health Sciences Center, and I also run our LHSC Green team. So this is essentially a pitch that we got here a year and a half ago or so, and this was to switch to some biodegradable gloves. This presentation kind of applies to most biodegradable PPE though, things like gloves and masks. So the vendor pitch was that it's going to save a bunch of landfill space. It will reduce microplastics and ocean contamination. It will help create renewable energy from captured landfill methane. And ultimately, by switching to biodegradable nitrile gloves, we will be saving the planet, and all for just a little bit more money. So healthcare leaders are often seeing this as an opportunity to do something good for the environment. So it is an appealing prospect. But what does biodegradable mean? Obviously, Fiona kind of alluded to this, but it means that bacteria can digest them. So bacteria break down the plastic molecules for energy, and there's two types of digestion that occur. There's aerobic digestion, which is when oxygen is present. So those are composters, and anaerobic digestion so that means without oxygen present. So that occurs in landfills when stuff is buried underground, and then also in methane digesters. And that process consumes water. The byproducts of aerobic digestion is carbon dioxide, water, ammonia, and whatever residuals are left over. And anaerobic, without oxygen, your byproducts are methane, carbon dioxide, ammonia, and again, kind of the residual other stuff that isn't digested. So PPE waste in Canada pretty much always ends up in our landfills. So this is an anaerobic disposal environment where the biodegradable PPE quickly breaks down into that carbon dioxide and methane. Obviously, methane's a potent greenhouse gas that's 87 times more potent than CO2. The realities of our Canadian landfills are that there's minimal methane capture. So open landfill methane capture rates can be under 20%. We'll see an example in a little bit. And so most of the methane that's produced actually escapes into the atmosphere before the landfill is closed and sealed. So this means that very high greenhouse gas emissions from quickly decomposing items like biodegradable PPE are adding to the end-of-life greenhouse gas emissions. And while weighing the pros and cons, available landfill space is not a global healthcare issue like climate change is. So let's take a look at the vendor claims. It saves landfill space. This is true. I can't dispute that, but the space savings are essentially negligible, and the greenhouse gas emissions far outweigh the space saving benefits, in my view. The picture on the right here is an example of how much space 25 million nitrile gloves would take per year. This is the use case that we were looking here at LHSC, and that would take 38,000 years to fill a landfill for annual usage, and they're only open for 20 years. At the same time, you're producing all this gas, 120,000 meters cubed, that's just going into our atmosphere as well. Another vendor claim is that it reduces that microplastic and ocean contamination. You'll see this on a lot of the websites promoting biodegradable PPE. It doesn't generally apply for Canada. Our modern landfills in North America are built well and lined to prevent contamination. Layers of waste are compacted and often covered in dirt. So you can kind of confidently say that items sent to landfill will actually stay in the landfill, and we don't dump our waste into waterways. This is something that when we used to send all of our recycling and garbage overseas, typically our recycling is what went overseas, that's what would end up happening to it. They would go to open, uncovered landfills beside waterways. People would be picking through it, and then it just gets shoved into the lakes or the rivers, which makes it out into the ocean. But that's not how we handle waste here in Canada. Yeah. So let's look at the methane becomes renewable energy claim as well. So only a small fraction of it is ever captured while the landfill is open. Most of it leaks into the air long before energy recovery is even possible. Generating electricity from landfill methane is far less efficient and emits more greenhouse gases per kilowatt hour than grid-sourced electricity. So, for example, switching 25 million nitrile gloves, about 100 tons, to biodegradable would actually create around 4,000 tons of CO2 every year, which is equal to adding back onto the roads 1,200 gas-powered cars. The rule of thumb you can kind of use if you're considering something like this is that 1 ton of biodegradable PPE is equal to about 40 tons of CO2. Okay, it's important to note that while capturing landfill gas helps reduce avoidable emissions, the most effective solutions to keep stuff that biodegrades and produces methane out of our landfills altogether. This is why the green bin program that is launched, across Canada to divert our organics away from landfills and into very specific methane digesters is so critical. It's been such a wonderful thing that's happened from a landfill methane production. So when I started looking into this, I was like, okay, let's see what the data kind of shows, because I was curious. So there's some new tools online. I think it's carbonmapper.com or .org, where they have aerial surveys either by planes or by satellites. And anyone can jump on there and you can take a look at kind of the hotspots that they've done some analysis on. Don't recommend looking at Alberta. Oil and gas sector is pretty high, but it's interesting stuff. Either way, so there's a landfill right near us that a lot of the London garbage kind of can end up at. And it doesn't have waste to energy, but it does have landfill gas collection. What that means is they have all the piping inside the landfill and they expand it as they build it up, but they just burn it off. So they're capturing the methane and then burning it directly. Same sort of idea as renewable energy from landfill gas, which we can get into in a minute, but just nothing's producing electricity. So in 2022, they have little gas meters that can measure the amount of methane. This is all publicly available information. They captured and flared, 35 or 33 million meters cubed of methane. When you extrapolate that out, that's about 67,000 tons of CO2 prevented from reaching the atmosphere, which is great. The aerial observations in 2022 of this site, though, show about 1,000 kilograms of methane still being emitted throughout the entire year. And so that's equivalent to 762,000 tons of CO2 of methane still going into the atmosphere. So this site specifically has about an 8% capture rate. So this, when I say like most of it escapes, like most of it escapes. You will find different information online from various sources saying capture rates are up at 70, 80%. What I think this aerial observation data is showing is that that is vastly underreported and nowhere near those values. This is the same thing happening across the oil and gas sector as well, where they do their own site surveys and say, all right, this is how much methane we're emitting. And then, now that we have satellites that can actually have a much better view versus these kind of handheld monitor tools, we're seeing that the actual emissions, both CO2 and methane, are much higher than what was previously been reported. Now, when a landfill is closed and sealed up, not as much methane escaped, and your capture rates do actually increase because they put a nice liner over the top. It's all compacted, plant some grass on top of it. So there, at the end of life, so after that 20-year time span, you can actually get capture rates up at 80%, let's say. But all this stuff is supposed to degrade, and it's advertised as degrading under the ideal conditions inside of about 1.5 years. So most of your biodegradable PPE will have degraded prior to the landfill closing. And if they say, well, that's ideal scenarios, and in reality, it actually takes longer for it to degrade, and maybe like 5-10 years, then the response is, okay, so then there's no benefit really to the space savings that you're supposed to be getting from going to biodegradable PPE. So we're going to look at a quick life cycle of nitrile gloves. So PPE, like nitrile gloves, are often made from fossil fuels. So when you burn it, you're burning a fossil fuel at the end of the day. So it's not renewable energy. So either way, you take that fossil fuel, you send it to a processing plant that's going to convert into the components that you need, and then it goes to other locations that create the actual nitrile gloves. Regular gloves will then go to the landfill, and they'll sit there inert for thousands of years, more or less. Maybe there'll be some slight degradation from mechanical compression over time, but generally they're not doing anything. Biodegradable gloves, though, will start biodegrading. From that, you get your landfill methane and CO2 leakage that creates the greenhouse gases. If your landfill has electricity from methane with that landfill gas, you are going to be producing non-renewable, high emissions electricity. Typically, these generators are not cogen, so their efficiency is somewhere between 27 and 34% efficient at producing electricity from your methane source, which makes it the least efficient way of producing electricity that's going onto the grid. And at the same time, every time you're burning methane, you're also creating CO2, which is more greenhouse gases. So, man, we got some water. You want to go for a counterintuitive win. When vendors are proposing both options, make the choice to purchase non-biodegradable PPE to avoid tens of thousands of tons of future greenhouse gas emissions. This is my opinion on this. If you prioritize landfill space savings here in Ontario, and you've done your comparison between greenhouse gas emissions and landfill space, and you're like, okay, landfill space is what we care most about, that's fine, that's your decision, but do come into it knowing kind of the full story. In my opinion, sticking with non-biodegradable is not a flashy decision, but it's the right one for the planet, your budget, and your healthcare facilities credibility. So the bottom line is not every product labeled biodegradable or compostable is better for the environment. Sometimes the most sustainable choice is the one that resists decay and avoids turning into potent greenhouse gases in our landfill. So what can you do? Fiona kind of talked about this, but use PPE appropriately. Overuse drives waste. There's lots of training and awareness campaigns like those from Cascades and Canadian Coalition for Green Healthcare that can help. Choose reusables where possible. They almost always have an environmental footprint. There's a big push across all of our organizations here to go to reusables, and it's great to see. So support fact-based procurement. Ask for life cycle analysis, not just marketing claims. Get help investigating. A choice is sometimes what vendors tell you and what reality aren't aligned. One of the stories I like to tell is that we had a single-use gown vendor tell a group of us, including like 40 physicians, that single-use gowns had no transportation emissions because they were bundled with other products. So sometimes, and I don't think these opinions or ideas come from a bad place, it's just there's details to these things that can get complicated. So ask for help. Talk to your local sustainability experts, reach out to your green team, your waste specialists, or organizations like Cascades, Canadian Coalition for Green Healthcare, U of T's Collaboration Center, Mohawk MedBuy has formed their ESG committee. If you're with Mohawk MedBuy and you're a hospital, you can ask to join that if you're not already. Consider how you can approach future PPE procurement. So get ahead of it. Establish procurement policies that avoid biodegradable or compostable PPE unless it will be managed in the appropriate waste stream to enable the intended environmental benefit, which it likely will not. Too much talking, which it likely will not. There are some PPE collection organizations that do this. However, they are expensive, and I have not seen them done in any hospitals yet. So share this information with PPE decision makers like your IPAC teams. If you're already purchasing biodegradable or compostable PPE, evaluate if there's an opportunity to switch back sooner within the contract obligations. You can reframe it. Switching away from biodegradable PPE will reduce thousands of tons of greenhouse gas emissions per year, avoid greenwashing claims, and save your hospital money. It's one of the easiest environmental projects you could do that saves money in the process. I'll leave it there. I'm going to quickly scroll through the next few slides just for awareness in case anyone wants to ask questions about it. But this is sort of the comparison that we did here for the 25 million nitrile gloves on space savings, emissions volumes, microplastic contaminations, and greenhouse gas emissions. There's lots of formulas to back this stuff up. And then, yeah, that's it. Open to questions.
Thank you, Mike. So I guess to conclude how green is green, I guess the answer exists on a spectrum, and there is opportunity for innovation, ranging from changing clinical behavior to product materials, even to waste management. And so as Mike mentioned, we would be happy to stay on and answer any questions in the Q&A. Or if there's anything in the chat, I don't see any questions that came in as of now. And here's our first question. Assuming this is solely for the disposal of gloves, which aren't contaminated, which are then sent to your biomedical waste. I was on a call with American Red Cross the other day who are looking into an on-site autoclaving device to decontaminate and then send to landfill. So I believe this is to you, Mike.
Sorry, so what's the question there?
Is this assuming that the disposable of gloves aren't contaminated and then sent to your biomedical waste?
Biomedical waste, I believe, is incinerated. I'm not a waste specialist. Oh man, I can't even talk anymore. Um, but yeah, so I guess that might end up being better than landfilling where it's producing methane because it's just getting burned. But I don't know why you would really, yeah, I mean, I guess you could autoclave it, but yeah, I've never heard of that. Typically, the gloves are just thrown out into the general garbage.
There's a comment in the chat that supports that says gloves are not considered biomedical waste unless grossly contaminated.
Yeah, that's my understanding of it too.
Another question asks, how does recycling play into this equation? I.e., would recycling PPE, should that be an option, be preferred over landfill?
Can you find someone to recycle PPE? And is it possible at a large? So my focus is always large scale hospitals. From a contamination perspective, I don't think much PPE can be recycled. And even separately sorted and sent out, like compostable masks that you can purchase, they generally can't really be done because when you have the mask, it's compostable, but the aluminum piece is not, the nose piece. And typically the ear loops are not either. So what you're then asking is all your staff, when they go to put their mask in a separate disposal bin, specifically that will go to a composting facility instead of landfill, you're telling them that they need to remove all the aluminum pieces and take off the ear loops. Having heard the complaints from my waste specialists, I can tell you that would never be possible to have at a larger healthcare institution. I think within smaller clinics, absolutely. I think there's a lot that can be done in smaller clinics where you can guarantee that items are properly separated, and maybe you can take advantage of commercial composting or commercial anaerobic digesters. But hospital systems, there's way too much contamination that none of them will take hospital PPE that I'm aware of.
Can I just jump on to this also just for a couple of comments? Raluca Radu is talking about recycling PPE in a program in BC. I guess I think that may well work, but therefore the bio aspect of the product it may well complicate that effort. It certainly doesn't strike me as being a useful contributor if at the end of the day what you're trying to do with these polymers is recycle them. Then if they've got these biodegradation properties, that could actually complicate that. And Mike, I don't know if you can speak to this, but my understanding is one of the challenges with some of these sort of biodegradable polymers is also that they will mess up your waste streams. If you've actually got a recycling waste stream that's clean, that getting a biodegradable set of polymers in there make that a dirty way, not a dirty waste stream, but a non-pure waste stream anymore. You've downgraded that material from a recycling perspective. So even if what people are suggesting is like, let's look at recycling PPE for all the challenges that Mike is saying, maybe there's a pathway there, but doesn't strike me as why would you try and do that with biodegradable polymers? That there's definitely no reason for paying more for a biodegradable polymer if you've actually got a pathway to recycling. So I guess this is being raised as an alternative if we're thinking about how do we deal with the plastics challenge. And I think Sandra and I both and Mike emphasized reducing bioplastics not being the solution. People are saying there may be a recycling pathway for some of these things. And I know that's been an issue with, vinyl, clean vinyl. And I think people have some concerns about that, but certainly there can be some of the recycling of the vinyl products that come out of healthcare that are very, very clean. But again, bioplastics don't have anything to contribute to that and might actually mess up your recycling program. That's my understanding.
Yep. Yeah, I would agree with that. And yeah, I mean, there are certainly ways to recycle PPE.
Thank you. Now let's talk a little bit about the life cycle analysis. So question is about life cycle calculation. Any GHG reduction in manufacturing biodegradable PPE is more that offset downstream. So
Yeah,
I think the question is,
yeah, I mean, how they make it biodegradable is they take nitrile gloves and then they have an additive in there that attracts bacteria to it. So it can only be additive. Otherwise, they're the same gloves. So you won't get less upstream emissions.
building on that question is another question that asks, how easy is it to get the LCAs about these products that are valid or peer-reviewed? How well are healthcare purchasers equipped to evaluate LCAs?
Fiona, you want to take that? I think we have an LCA database, Canadian Coalition for Green Healthcare, I think that's one, or Cascades, one of them.
It's Joan O'Drew's. It's Healthcare LCA. We've supported them over the year, but it's based at Dow. Joan O'Drew developed it with colleagues there. So it's an open access database. It's of publications of LCAs in the healthcare space. So you can link to it from the coalition, may have a link. We have a link to it from the Cascades, but I'll find and put the link in here. Oh, thank you. Thank you, Katie. Healthcare LCA. So that's a great resource. It is, of course, there's lots of issues with this. Just talking about healthcare LCA, this is publications. So these are peer-reviewed publications that have done LCAs in healthcare for healthcare products and processes. And even in that context, which is the high-value LCAs, we don't yet have a consistent methodology across different product categories or even within product categories where we can be confident that an LCA of this intervention is adequately comparing to an LCA of this intervention. So I think there's more to be done on the science there. When you're talking about a vendor's own LCA, yes, I think you have to have concerns about who did that, how it was done, whether it would pass the test of peer review. And broadly, I think this is a challenge for procurement. Obviously, this is a challenge that procurement can address by the whole value of procurement as a collective enterprise, or one of the values of procurement as a collective enterprise is not, to my mind, simply this reducing the cost through volume, but is actually concentrating the expertise, is concentrating the capacity to purchase well. I think we're very much on a journey to do that, to create really, really robust capacity to both establish the criteria and establish the adjudication processes that are capable of making substantive demands from a sustainability perspective in the healthcare procurement space. And some places are doing this more. I think BC's invested a fair bit in their centralized procurement process in doing this. And Mike mentioned Mohawk MedBuy is doing some work and HealthPro is doing some work. So that's work for us to do. But I would be a little bit cautious about a vendor's own unpublished LCA.
Yeah, having reviewed a few of them for various things. It is hard to evaluate if you are not an LCA expert as well. There's ways to present data in such a way where you're not presented with kind of a clear view of the alternate ways of presenting it. Is I guess how to frame it. It helps to have an LCA expert that you can reach out to help dissect some of these if it's something that you're trying to do a deep dive in. And yeah, be wary of vendor LCAs for sure.
Thank you. Next question in the Q&A says, great presentations. Thank you. I find people can get a bit discouraged when we recommend not using a product or a program that is marketed and widely believed to be green. Do you have any tips for managing these kinds of changes in a way to help people stay optimistic? That's a good question.
Well, I can start and Mike will follow. I mean, there's lots of things that we can do. But yes, there is this temptation to get quick wins. And some of these things look like quick wins and people are tempted to go down this road. What do we do about this? It's definitely a challenge. there's growing enthusiasm, but there isn't necessarily the structure, the infrastructure, the capacity to support that enthusiasm and channel it productively. I think we just have to be honest about the fact that advancing the sustainability agenda in healthcare is going to involve some, low-hanging fruit. There's some things that we can do right now that we know how to do. But there's going to be things that are a bigger mountain to climb, and we have to be preparing ourselves for the long haul. I think that one of the things that really, what I was trying to suggest a little bit when I was talking about demanding true innovation, is that I think that people jumping on the quick win or the supposed quick win of a greener glove are getting in the way of the longer term agenda that we have for transformation, because they're accepting low quality and they're not shaping the market in the directions that we need to go in. So I think we need to be quite intentional. I think we need to be strategic. I think we need to pull together a portfolio of innovations and interventions that we want to advance. Some of them are going to be easy. Some of them are going to be by next Tuesday or over the next 6 months, but some of them are going to take a fair bit of build. Some of them are going to need to have very significant collaborations with researchers or other networks to actually do it well. And I think that's what we're seeing. The community is growing and maturing in its capacity to collaborate and to make demands. So I don't think this should be disheartening. I think this is part of the game we're in, and what we should recognize is, I think, some excitement about just how much this space has changed just in the last 5 years in terms of the engagement, the energy, the enthusiasm. But it's not all like simple stuff, nor should we expect it to be. So don't be disappointed by that. Just be strategic about how to navigate the space. Mike?
I don't have much to add. That was a fantastic response. But yeah, the draw for a quick win, I think, is there are so many good quick wins, actual ones. So let's, yes, I understand you might get discouraged by this one not really working, even though people think it's so much better. However, if you end up doing it because you want a quick win and want to advertise a quick win, you haven't won anything, right? Like all you've done is a PR thing, which is why we now have Canadian greenwashing laws. So just there's so much that is available to do. Let's put our efforts to things that we know for sure actually have benefit in our goals in the broader sustainability context. And as Fiona said, lots of low-hanging fruit and then lots of very complicated stuff that I think, as all the organizations are working together to pull together these projects and share information and make everything easier for everyone to kind of do.
And just from a project manager's perspective, I think another strategy is to work in a team. Having a green team at your facility, people that you can depend on and celebrate the wins with, boosts morale. And when those tasks that are a bit more challenging and take longer to accomplish, it always feels easier to do if you have a group of people that have your back and you can depend on as well, than just going through it alone. The next question is, I'm aware that some PPE manufacturers have built in collection and recycling programs. Kimberly-Clark is one I am aware of. What other resources are available to healthcare facilities or organizations to identify vendors that may be offering similar systems?
I feel like passing this to some people in the audience. We got Raluca, we've got Lisa Van Lint, we've got, Katie Cohen, we've got Linda Farangu, we got a whole bunch of people out there, all sorts of expertise who could answer some of these questions way better than I could.
Definitely. There is actually a comment from Victoria from Hamilton Health Sciences that people have been agreeing with, saying that PPE recyclers are very expensive. When calculating your costs for new waste programs, consider calculating costs on a per kilogram or per metric ton basis. So you can then compare cost for PPE recycling per kilogram versus per landfill, blue box, biomedical, etc. This will give you good insight into the financial viability of these as new programs. When we ran our numbers for our PPE recycling program at Hamilton Health Sciences, we were only capturing 8% of all masks, and the recycling costs were $20,000 per metric ton versus biomedical at about $2,000 per metric ton. It was a high cost program with very little return on financial investment. And then comments in the chat are agreeing that they have found similar results at their facilities.
Yeah, I mean, just broadly, I do think, I don't know if Linda was about to jump in there, sorry, but that, one of the interesting issues about the life cycle environmental impact, and as we learn more about life cycle environmental assessment, is we come to understand that so much of the impact is upstream, or even downstream of what's visible to us. And so a lot of people get involved in environmental sustainability in healthcare because they're dealing with waste. They've got this very, very physical phenomenon in front of them. They're taking bags of waste out of a ward or out of the operating room, and they're really distressed by that. And they tend to sort of, the volume of it becomes bigger than its actual sort of impact. Like there's this great image that I often show, many of you will have seen, that's of this artist, I'm forgetting her name for the moment, who took a picture of herself from her surgery and anesthesia, and you see all of these products around her. But one of the things from that image is that some of the smallest products in that image, some of the ones you can barely see, like the drugs, are the highest environmental impact products there. So that the size alone or the volume alone is not a good indicator. And by the time they're waste, the vast majority of the environmental damage has often been done upstream in resource extraction and manufacturing and transportation and processing of various sorts. So part of the development that I think our community is going through as we increasingly grapple with these issues is we are starting with this focus, oftentimes on waste, and then we're moving beyond that focus. And we're coming to understand that just focusing at the end of the pipe on the waste products and how to manage them, whether recycling them or repurposing them. Yeah, there's some time and energy we can put there, but oftentimes those are high effort, low impact interventions, and we need to push upstream into some of the interventions, some of the practices and processes that are going to reduce those things becoming waste in the first instance. So I think there is a need to shift the conversation in environmental sustainability away from what sometimes feels to me to be a far too much focus on where people start sometimes, which is waste, right? Like it's upstream of that. Much of the issue is upstream of that, and we're not going to solve this problem focusing it on the end of the pipe.
Anything to add, Mike? Or
Nope.
no?
No, that's great.
Okay, amazing. A question in the Q&A is asking or wondering whether there has been any research on best ways to enforce unnecessary use in the same way as we have hand washing monitors. Has anyone piloted the deployment of unnecessary glove use monitors?
Well, again, this is where I kind of wish some of my colleagues online could jump in. I think Raluca, Radu, and the work at Providence, as I understand it, on reducing unnecessary glove use, actually really focused on the clinical questions of appropriate use. And my understanding is a lot of the campaigns have occurred around the country of reducing unnecessary glove use, and it's not always the case that focusing on the reducing unnecessary use is incredibly compelling to folks who are busy in the workplace. But a message, as I understand it from Providence, from the work that Raluca and colleagues did, was really focusing on adhering to infection prevention and control guidelines, which themselves would suggest you don't need to be putting on gloves to deal with unbroken skin. Just, taking the temperature of a person is not required. So don't do it. And focusing on these core questions of quality care are going to be a critically important way to engage busy frontline workers in making these changes. And it's not necessarily the case that the green agenda is always or going to be a helpful addition to that conversation. And I certainly wouldn't want to get into a punitive. I think we got to be cautious about, monitoring and punitive sanctions and stuff like that. We need to engage folks in this process. But that's my understanding. Raluca, have you put conversations in here? Yeah.
They did, and I just copy and pasted their
Great.
answer,
Thank
brought
you.
it back to the chat. And there is a question about incontinence pad usage. And kind of, I think we can link that to the answer to this question, where there are cases in the UK where they promoted interdisciplinary collaboration for treating urinary incontinence. And so kind of just the way that they approach treatment, differing that actually did lead to a considerable reduction in waste, specifically plastic waste, but also positive patient outcomes. So I think they go hand in hand. And I agree everything that Dr. Miller
I just
said.
want to add something that Fiona said. I
Mhm.
I don't think when you're doing campaigns like blood reduction that the environmental aspect should be the main focus of it. I think from one of the big projects we did here was printing reduction, so trying to get 10% printing reduction across the hospital, which we've just achieved. We attached it. We attacked it a bunch of different ways. We did the environmental aspect and made it like, all right, every year LHS is cutting down all the trees in Springbank Park. Very tangible for everyone, right? So there's the environmental thing that gets some people motivated. And we also did the financial side of it. It's costing us X number of dollars per year. And you can drastically reduce your costs within your department. That's within your capacity to do. And then the other is just like, we can also help improve the efficiencies of your processes. So we can't give you dollar values on that, but now people are spending less time walking back and forth to the printers because they've changed their process flow for everything. So providing kind of the information across all the different domains has been helpful because everyone we found, like different managers are motivated by different things. Same with people. And I think that's kind of an interesting aspect. So don't shy away from sharing it, but don't make it like the sole focus. Like if you're thinking about the environmental impact of doing some campaign, share all the information and brainstorm how you can communicate that in a relevant way to all the stakeholders that you're working with.
And just being mindful of time, there's one more question in the Q&A that we haven't answered, that it asks, if either of you had a magic wand, what would be the first thing you do to continue supporting healthcare facilities to becoming more climate resilient in the face of forecasted impacts?
That's a big question, and climate resilience is a huge answer. I mean, you're talking floods, depending on where your hospital is. It's very localized in terms of the impact. Having for me as an energy management specialist with extended heat waves, my magic wand for climate resilience is okay. We need to upgrade our chilled water system to ensure we have cooling for that week-long period in summer when it's 35 plus degrees out. That's like the climate resilience that should be top of mind. Like I'm not about to say let's reduce glove use. Again, part of our hospital is in like a flood zone. Probably not the best, right? Like, what can we do to mitigate those types of impacts? So, I mean, those, from my perspective, those are very kind of site specific and technology specific for the climate resilience aspect of it.
I'll jump on and just add a few thoughts. One is that relevant to the topic before us today, I think that there's an argument that reusables potentially can improve resilience. I think certainly some of our BC colleagues found that with reusable textiles in terms of creating a system, whereby the textiles that they had, the total volume of textiles could continue to be reused. There was a local vendor able to keep them in circulation. So there's definitely an aspect of reusability and having the sort of MDRD capacity or external vendors that can support that. That's going to be relevant to reducing our vulnerability to supply chain disruptions, whether from a local climate event or a global climate event. That I think is quite relevant to our conversation today. More generally, I would agree with Mike, but also go beyond that and say that I think when we talk about climate resilience, we need to actually get beyond thinking about the facilities and thinking about the systems of care and systems of delivery, both in community and in institutions and the health workers, formal and informal, because the resilient systems are going to be key to managing growing shocks and stresses. Thanks.
think that's the perfect note to end off. Thank you so much for all of you who attended the webinar and for your participation. And thank you, Mike and Dr. Miller, for your perspectives.
Thanks for attending, everyone.